How should we treat shoulder calcific tendinitis? Hello, this is Dr. Siddharth Damber, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Patient I saw today that I've known for a number of years came in with right shoulder pain. She's had intermittent right shoulder pain for years on and off. She's right hand dominant. Today, on examination, she has findings consistent with likely rotator cuff tendinitis. On ultrasound of the right shoulder, what we see is that she has some arthritis in the AC joint. That's the joint on top of the shoulder. She also has some mild tendon changes throughout the shoulder, in particular the supraspinatus tendon. That is the tendon that helps you lift your arm above your head as well as reach behind your back. She has evidence of a partial thickness tear as well as significant calcifications within the tendon itself. So she has calcific tendinitis. In her case, we have actually evaluated her shoulder in the past, and her shoulder findings are stable. By that, I mean her shoulder findings have not progressed. So, how do we treat someone who has chronic rotator cuff tendinitis, partial thickness tear of the tendon, as well as calcific tendinitis? First off, let's understand what's going on here. So, when you look at her entire shoulder, someone who's got tendinitis of the shoulder, who's got AC joint osteoarthritis, who's right hand dominant, she is physically active. She's actually a physical therapist herself. She's done all the right exercises for the shoulder, activity modification, dietary, anti-inflammatory changes, over-the-counter joint supplements. She's done everything correct in that regard. In her case, she has been physically active during her lifetime. At some point, she's likely strained her shoulder with some sort of either physical activity, either during her exercise or routine activities, may have strained her inferior glenohumeral ligament, very common ligament to strain underneath the shoulder joint. That then leads to some slight upward migration of the ball and socket joint. That then puts a little bit of stress on the AC joint, which is why she's got some arthritis there, and also puts some stress on the rotator cuff, which is why she has some chronic rotator cuff changes. So she has an issue of instability. And in her case, she's done everything correct in terms of lifestyle changes. And we are now talking about possibly utilizing the following treatment to help her. To begin with, would recommend doing what's called percutaneous barbotage. That means is taking a needle, numbing up the area, and just needling out some of the calcification, because there's enough calcification there where it's not just a mild bit in the tendon, it's a little bit more like a moderate level, and she would benefit by removing some of that calcification. Next, we do need to treat the tendon that's been chronically irritated and injured. We would inject platelets or platelet-rich plasma from her own blood into the tendon as well. She does have some arthritis on the top of the shoulder, the AC joint, so we should inject platelets into the joint there as well. And then, of course, we should treat the ligament underneath the shoulder, the inferior glenohumeral ligament, that is likely starting this whole process of instability and stress on the joint and the tendon. In her case, my expectation is that she will do well. She has a moderate level degree of pathology. She's otherwise healthy. She has great range of motion in the shoulder. And my expectation is that will not only help her out from a structural standpoint, will also help her out from a stability and functional standpoint, and she'll be able to continue her very active lifestyle as well. If you have a shoulder issue that you think requires nonsurgical evaluation management, check us out at chicagoarthritis.com. DM us if you would like to be evaluated. Thank you.